Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. What are the tests to be done before conducting myolysis? First and foremost test, even if you are conducting a myolysis or UAE or RFA or myomectomy or hysterectomy or any sort of female operations as such, the first and foremost thing that you need to do is USG, which is ultrasonography of abdomen and pelvis, to know what are the problems associated with it. How are the fibroids? Where are they located? Is it always paired up? Sometimes people pair up or have diseases which are paired, like fibroids with bulky uterus, fibroids with endometriosis, fibroids with adenomyosis, fibroids with PCOD. We have seen cases in our clinic also which have paired up, or even triple diseases also. Sometimes they have fibroids, sometimes they have PCOS, fibroids and bulky uterus. Sometimes they have PCOS, fibroids and endometriosis. So we have seen cases like that and we have treated it. So if you are having any sort of those conditions, it is advisable to view it in the USG, and then to confirm those things we have to get an MRI. As you can see here in the picture, this is an MRI where, as you can see, this is the uterus, these are the pelvic bones, and this is the fibroid. So as you can see here, this is the bladder. As I told you, any fibroid can cause pressure on the bladder. Here it is causing pressure on the bladder, which is causing the bladder to become different. It is forming the bladder to become in a different shape. It is pressing down the bladder where you can have urge incontinence symptoms. So even MRI is also very important to know the dimensions in a proper manner. Apart from that, hysteroscopy, if you are someone who is suffering from submucosal fibroids, if you want to know what are submucosal fibroids, what are intramural fibroids or subserosal fibroids, or what are fibroids as such, and what are the causes of fibroids, and what are the investigations, general investigations to be done, and what are the treatment options, we've already done a video on it. We will be providing you with the link in the description box. You can go and check it out. And also, not to remember, we have already done a video on the hormonal changes and also pregnancy causes for fibroids, or how is pregnancy affected due to fibroids. If you want to know about all of that stuff, we will be providing you with links in the description box. Please do check it out. If you're someone who's suffering with submucosal fibroids, then hysteroscopy is one of the procedure where a hysteroscope is inserted into the vaginal canal or into the vaginal orifice with a camera and a light in it to view the fibroids in a better manner. Apart from that, SIS, saline infused sonography, is also done to see the viability of the tubes and how far or how extent the fibroid is and how far you can remove it. So these are the primary tests. Apart from this, there are certain tests that you need to do when you're getting a surgery done. It can be any sort of surgery. So let's know the other kind of test. CBC. So what is CBC? CBC means complete blood count. So in complete blood count, we will be knowing if you are having any sort of infection. Like if there is any sort of infection, you will be having a raise in neutrophils if it is acute, or raise in lymphocytes if it is chronic. How is your blood count? How is your HB? All of this we will be knowing about the quality of the blood, which is very important for surgical processes. So that is important. And apart from that, we have to do an ESR, which is called as erythrocyte sedimentation rate, which is important as it reflects the infection. If you have any sort of infection, you will be having a raised DR. If you have any sort of infection, we cannot get this myolysis done. So that's also very important. Apart from that, coagulation test is also very important, because if you're someone who is having coagulation issues or blood clotting issues, blood should clot after a surgery because you are putting a puncture, you're having a puncture done on your abdomen, right? If the blood isn't clotting well, if you're having coagulation issues, the blood will start to flow. There will be hemorrhage. It can be very hard on the heart, and it can need blood transfusion, or you will have to stay for a longer period of time in the hospital. So that is also very important to do coagulation test. Apart from this, to know if you're pregnant or not is very important before a surgery. So we have to do human chorionic gonadotropin test to see if you're pregnant or not. So these are some of the tests that have to be conducted before myolysis. If you're someone who's suffering from fibroids, adenomyosis, endometriosis, PCOS or PCOD, or if you're someone who's suffering from bulky uterus, dysmenorrhea, Bartholensis, any of the female reproductive organ diseases, you can contact or you can choose Fidicus Homeopathy, as we have high success rates. Here we have two kind of consultation options. The one is the online consultation option. The second one is the offline or the in-person consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying far away from the nearest branch of Fidicus, you can contact us online through audio consultation options or through the video consultation options. And after the doctor consultation has been done, we will ask you for investigations, whatever are needed for your condition. And if you've already got those investigations done, you can share it with us. After this whole procedure is done, especially to the online clients, we will be delivering you our medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. If you're staying anywhere else across the globe, it can take 4 to 8 business days. We're mentioning here clearly it will take business days because holidays and other things are not included in this. Particularly 3 to 4 business days is what we are proposing. If you're someone who are suffering from female reproductive organ diseases and you would like to get in touch with us, you can call us on this number. You can WhatsApp us or message us on this number. If you're someone who wants to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from fibroids, if you're someone who's suffering from endometriosis, adenomyosis, or if you're someone who's suffering from bulky uterus, dysmenorrhea, PCOD, or any other female reproductive organ diseases, and you would like to choose homeopathy because we've told you how homeopathy works best for all of this, why should you choose Fidicus Homeopathy apart from other homeopathy doctors? Remember that Fidicus Homeopathy stands for highest chance of health. Here, compared to other doctors in homeopathy, we have highest success rate. We have top-notch doctors and we are treating it with high success rate. First thing. Second thing, we have transparent treatment. What do you mean by transparent treatment? We do not have any gray area between the patient and the doctor. Here we will be talking to you about your prognosis and also about the condition of your fibroids also, and also the personal care here at Fidicus is top notch. So if you want to choose health, if you want to choose cure, if you want to choose a doctor who is going to address all of your issues, answer all of your queries, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.